Our last segment is the approach to non-reassuring electronic field monitor tracing. Now, we've talked about this briefly with our generic interventions that we just talked about. Here's our case. A 20-year-old gravida 1, 39 weeks gestation, is in the active phase of labor, 7 centimeters. The electronic field monitor strip shows a baseline heart rate of 175. Upper limits of normal, 160. So this is tachycardia. Variability is good, 7 beats a minute, but there are repetitive late decelerations after each contraction and no accelerations. Are you happy? No. Is this baby in trouble? I don't know, but it's non-reassuring. The first thing you need to know is recognize that most abnormal, non-reassuring tracings are not caused by fetal hypoxia. Ask yourself, does the tracing have biological plausibility? What does that mean, biological plausibility? We have 2 patients. They both have the same tracing. One is a 22-year-old, prima gravida, healthy, no medical complications, no obstetrical complications. Second is a 41-year-old mom who's got chronic hypertension, type 2 diabetes. Which one of these women has biological plausibility regarding a baby that's not doing well? Obviously the second one. I'm going to be far more aggressive with the second patient, the hypertensive diabetic, than I will with a normal woman. Much more likely that it's going to be a false tracing with a young woman. Then, what do? Examine the electronic field monitor strip carefully. Confirm the abnormal findings. Is there tachycardia, bradycardia, severe variable decelerations, late decelerations, absent variability? If there is, identify other non-hypoxic causes. Let's say, for instance, the mom has a tachycardia, the baby has a tachycardia, and she has a fever. Is this baby in trouble? No, this is a normal physiologic response. And we talked about the medications, beta agonists, beta blockers, local anesthetics, and so on. Is there an explanation other than hypoxia? If not, then we initiate our intrauterine resuscitation. Shut off the oxytocin, give terbutaline, 500 milliliters IV bolus of isotonic fluids, turn the mother on her side, give oxygen, okay, all that good stuff. Did it help the tracing? Does it look better now? If it does, great, you're done. If it doesn't, in spite of all of your interventions, we have the persistence of the non-reassuring strip, no explanation for it, you're basically stuck. If it's the first stage of labor before the cervix is completely dilated, it's going to be an emergency cesarean. If it's a second stage of labor, now we have potentially to do a vaginal delivery, vacuum extractor forceps, or an emergency cesarean. But if you cannot, with your interventions, get a reassuring strip, then you're basically obligated to do an emergency delivery. And that is the end of approach to non-reassuring electronic fetal monitor strip.